In this video, I'm going to talk to you about lumbar spine stenosis. I'm going to talk to you about signs and symptoms and some of your treatment options. But make sure you stay tuned until the very end of the video, as I will be talking about a serious topic, a few very important symptoms that you do need to be aware of and monitor that require urgent medical attention if you do have stenosis in your lower back. So what is it? Well, lumbar spine stenosis refers to age-related change whereby there is less space around the spinal cord and or the nerves that travel out of the lower back. And this can cause irritation, sensitivity, and sometimes also compression of those structures. Now, whether you have central or to the side stenosis, you'll probably experience some back pain, but the symptoms in the legs will differ. So if it's central, you'll often experience symptoms in both legs, whereas if it is on only the right side, for example, you'll only experience right-sided leg symptoms. Now, these symptoms can include anything to do with nerves. So nerve pain typically presents with pins and needles, numbness, heaviness, weakness, or burning type sensations. And what you'll often find with the central stenosis is that these symptoms come on after a set period of time. Now, stenosis tends to fit a very consistent and predictable pattern. So in terms of when these symptoms are likely to come on, it's most likely to be when you are walking and standing, and they are likely to be relieved by sitting or lying. So what you'll often find is that this behaves quite consistently, so you may be able to walk for half an hour and then you start to develop these symptoms travelling down both legs. Or you stand up for 20 minutes, you're doing stuff in the kitchen, and again you start to notice these symptoms build up in the lower back and the legs. Now, spinal stenosis is a clinically diagnosed condition. That means you don't need scans or investigations to make a diagnosis of stenosis. And the reason for that is because once you've listened to people with stenosis over and over, you will realise that it fits a very consistent presentation. So we spoke about the leg symptoms. They typically come on with walking and standing, and they're commonly relieved by sitting down, lying down, and leaning forwards. And these two aggravating activities will also behave quite consistently. So if you have a threshold of 30 minutes of walking before your symptoms come on, then typically that will continue at that level for quite a while. You'll go for a walk, and after 30 minutes, symptoms will come on. And often they will build and build and build if you keep going until you do something to change it, like leaning forwards or sitting down. And the same applies to standing. If you can only stand up for 15 minutes before you start to develop back and leg symptoms, then it will consistently be 15 minutes for a while. It tends not to fluctuate significantly. So you tend not to be able to do 5 minutes today and then 20 minutes next week and then 10 minutes the week after. It tends to be quite a consistent, predictable picture. I very briefly mentioned that leaning forwards or spinal flexion can alleviate symptoms. And this is because if you do have spinal stenosis, particularly if it's progressed, you lose extension. So extension is the movement where you arch back. Now, what you'll find is, particularly, like I said, if it's more advanced, you will feel more comfortable being in that kind of hunched, leant over position. People often tell me that when they go and do their weekly shop, they find it comfortable leaning on their shopping trolley, or if they are taking the grandkids out for a walk, leaning on the buggy alleviates symptoms. So don't have a go at friends and family if they are stooping or flex forwards. It's probably not a fault of their own, and it's just because that age-related change has occurred in the lower back, and it means they no longer have the ability to arch their back because the range of movement is just not there anymore. So it's very simple to summarise in terms of symptoms. Worse with walking and standing, alleviated with sitting, walking and lying. I do want to mention just quickly at this point, if you do have symptoms travelling down your legs, that could be nerve pain. This does need a physical examination to make sure that your nerves are functioning properly. If we move on to treatment and management, you have a number of different options ranging from conservative, which generally we do try first, to more invasive. Now, those options are going to depend on how much it's impairing your function, but you would have heard me use words in the video so far like consistent and predictable. So once you have been assessed and we're confident it is spinal stenosis, then one option is do nothing. Okay, if you are able to walk for half an hour before symptoms come on, you're able to stand for half an hour before symptoms come on, then that's likely to stay the same for a while. So you could just modify your activity, tweak your routine, adapt, be flexible, but just keep doing what you're doing. So if you take the dog for a walk and you know that at 30 minutes your symptoms are going to come on, then you take the dog for a walk for 25 minutes, you sit down, you let your symptoms settle, and then you go for another 25 minutes. If you are in the kitchen and you're prepping food and you know that symptoms are going to come on after 15 minutes, you do a bits and pieces in the kitchen, you sit down, you prep your veg shat down, and then you can do another 15 minutes of cooking. So one option is we do nothing and you just modify your activity. The next option is you could get yourself in front of a physiotherapist or physical therapist, somebody who is a specialist in treating people conservatively with spinal stenosis, so they can give you more education, more advice, and they can put together a bespoke rehabilitation program for you to try and get you moving a bit better, maybe try and get your back a bit stronger. Typically you will be given these flexion based, so these bending based stretches, because we know that they tend to alleviate symptoms for stenosis. So if you did need more bespoke help and a bit more one-to-one attention, then physiotherapy or physical therapy is probably your second option. If you had tried those things and you hadn't got back to a level that you were happy with in terms of function, then there are injection options. Now, this is the point. As long as we did the assessment we were talking about earlier and your nerve function was okay, this is the point at which we would probably do an MRI scan to have a look at your back to see exactly what levels of your spine were affected, but also to see if there is a possible injection target. This injection is normally an epidural, particularly if the leg pain is worse than the back pain, and that will need to be done under an image-guided injection, normally in a hospital environment. They can be variable in terms of how long they last, ranging from anywhere between a few weeks even to a year plus. The message normally is, if you do go down the injection route, that you have relatively quick physiotherapy or physical therapy afterwards, so that we can use that window of improved symptoms to try and improve your function, get you moving a bit better and get you a bit stronger. Lastly, there is a surgical option, and the surgery is normally a decompression. So a spinal surgeon will go into the spine and they will free up that space that has become restricted to give the nerve a bit more space and hopefully reduce your symptoms. Now, who is this appropriate for? It could be appropriate for somebody that has been through all of the things that we've discussed. They're not back to a level of function that they're happy with. It could be for a person that we have done that nerve assessment on that I mentioned earlier, and they have significant loss of function. So you may have significant weakness in the legs, or you may have lost your reflexes. Those things are suggestive of quite considerable nerve or spinal compression. They could indicate that we might need to intervene slightly earlier. And probably the last person is somebody who has tried these things but has seen, as they've aged, this gradual deterioration in function. So it may have been that 3 years ago you could walk half an hour, 2 years ago you could walk 20 minutes, and you're now at a stage where you can't walk more than 5 minutes. And the hope would be that the decompressive surgery would massively increase your ability to walk and stand. And obviously when those things start to reduce, we need to think about your general health as well. So when that deteriorates, you're going to struggle to maintain your cardiovascular fitness, you might put on weight, it's going to decrease your mood, it might affect your sleep. So we need to think about the whole picture whenever we are thinking about surgery, to make sure that it is the right option for you. Now, I did say at the beginning of the video, if you did stay tuned until the very end, I would give you some very important information about symptoms you need to know about that require urgent medical attention. So, you have some very special nerves in your lower back called your cauda equina. Now, these nerves are responsible for some very important faculties. So, you need to be aware of any bladder or bowel changes. If we refer to bladder, we're thinking any retention, feeling like you want to pass urine but you can't, or incontinence. With regards to bowels, we are only concerned about incontinence, so lack of control. We're not concerned about constipation. There's lots of different things that can cause that, and if you're on pain relief, then that's probably why. The next symptom that you need to be aware of is saddle anesthesia. You may see it referred to online. That basically means numbness or reduced sensation in your private parts. Okay, so the saddle area is anywhere that would be in contact with the bike saddle when you sat on it. So if you have any reduced sensation or numbness in that area, then you need to take that seriously. The third symptom would be sexual dysfunction. So obviously that's slightly different for men and women. For men, we would be concerned about a new onset of erectile dysfunction, so difficulty getting or maintaining an erection, easy for me to say, or difficulty ejaculating. For women, we would be concerned about any loss of sensation during intercourse. And the last one would be any sudden loss of power in the legs. So you may start to notice your legs giving way underneath you. You may lose the ability to lift your foot up. These things are very concerning and need to be addressed quickly. How quickly? Well, if you notice any new symptoms that I've just discussed, you really do need to take yourself to A&E as soon as possible so that you are assessed by a medical professional. They may decide that you need further investigation, they may not, but it's the assessment that is going to dictate that. The issue that we have if you leave things is that the longer they are left, the more likely these things are going to be irreversible, which is obviously fairly life-changing. If you would like more information on this, have a little Google of cauda equina syndrome and you will find everything that you need to know there. I really hope you found that video helpful. If you did and you want even more free information, you can find a back pain ebook that I put together for you in the description below the video. You can also head over to the Genuine Physio YouTube channel. There are back pain exercises on there that you might find useful. There's also osteoarthritis workouts on there that you might find helpful. But if you have found this video helpful, please do subscribe to the channel so more people see it, and like it while you're there to show your appreciation. And whilst you are doing that, I will see you in the next one.